Advice on giving general anesthesia. Giving anesthesia. When undergoing surgery, some patients require anesthesia from the anesthesiology team to facilitate surgical treatment. There are several ways to give anesthesia depending on type of surgery, underlying disease, patient's choice. 9 steps to prepare yourself before receiving anesthesia. 1. Abstain from all kinds of food and drink for 6 to 8 hours. 2. Report your history of congenital disease and use of regular medications, such as antiplatelet drugs, diabetes medications, blood pressure medications, and others, as well as vitamins, dietary supplements, and herbal medicines to your doctors. 3. Report allergies to medicine, food, or all kinds of substances, and also your previous surgeries and other health problems. 4. Refrain from smoking at least 2 weeks before surgery to reduce flame and cough. 5. Remove nail polish and have fingernails cut short to enable measurement of oxygen at fingertips and absorption just due to lack of oxygen. 6. In case of receiving current types of surgery, which does not require an overnight stay in the hospital, you must have relatives who can assist in contacting the staff, act as a caregiver on the way home, and take care of you for at least 24 hours. 7. If you are pregnant or suspect that you are pregnant, you must inform the anesthesiology team because some medicines can pass through the placenta and may cause detrimental effects on the baby. If surgeries are urgent, it should be done after giving birth. 8. Remove removable dentures, contact lens, and all kinds of jewelry. If you have loose teeth, the anesthetist should be informed. 9. In case of illness related to the respiratory system, such as fever, cough, sore throat, sputum, or runny nose, the anesthesiologist must be informed in detail. Patients must recover for at least 2 weeks before anesthesia can be administered with minimal risk. An anesthesiologist, a specialist in general anesthesia, anesthetizes patients. Patients are given medicines through a saline solution until they feel sleepy and eventually lost consciousness. The patients will be unconscious. They won't see, hear, or feel pain during the treatment. Things to know. Side effects and risks of anesthesia can include such effects as drowsiness, tiredness, confusion, dizziness, nausea, vomiting, chills, sore throat, and hoarseness. In very few cases, patients may face more serious complications that can be dangerous, such as injuries to teeth or lips, sucking food particles into the lungs causing pneumonia, severe allergic reaction to anesthetic, and death. The advantages of giving anesthesia include that it is used in major surgery, which has painful procedures, and helps the patient to remain still. It is also used in pediatric surgery, surgery with severe blood loss, abdominal surgery, and surgery that creates anxiety and discomfort. When it's time to give anesthesia in the operating room, vital signs examination procedure, measure blood pressure, perform an electrocardiogram, check the oxygen concentration in the blood. Procedure for giving anesthesia. The patient will receive oxygen through an oxygen mask. The anesthesiologist will administer the medication via IV drip. The patient will become unconscious and may also be intubated. No pain will be experienced during surgery. After surgery, patients will be awakened by following orders to make sure that they wake up from the anesthesia. When patients are awake, breathing well, and are able to follow orders, the endotracheal tube will be removed, and they will breathe on their own. Behavior after receiving anesthesia. You will receive oxygen. You should take deep breaths in and out. to allow the lungs to fully expand. It can be done immediately after awakening. In case of experiencing pain at your point of surgery, notify the nurse for painkillers. The surgical incision site may have a rubber tube coming out from the wound or outside of the wound for drainage. Do not allow patient to remove these items. Be careful not to cause pulling, sliding, or slipping. In case of difficult breathing, if caused by sputum, cough effectively to remove phlegm from the throat. Take 2 or 3 deep breaths. Hold the last for about 1 to 2 seconds and hold the wound with both hands. Then, cut out of the throat 1 to 2 times to expel phlegm. Early postoperative ambulation. You should change your sleeping position regularly. Turn your body on your side at least every 2 hours and sit up and exercise as soon as you feel better. If your doctor allows you to eat, you should eat a little at first, then observe whether there are symptoms of abdominal discomfort or not. The next day, you can start eating normally, especially when returning to recuperate at home. You need to nourish your body because food makes you healthy and wounds will heal faster. Take all medications according to your doctor's treatment plan. If there are abnormal symptoms, you can call to inquire or come back to see doctor before your appointment date. Once you have received complete information and you are ready, please sign your consent. In the letter of the consent, for the use of anesthesia, complete before receiving the anesthesia service. We love you. May you all be safe, good health. Anesthesiology team, St. Mary's Hospital. Thank you.